Hi, this is Addy from the Gastric Couple, and I'm here today to bring you my story like we promised we would do, and it's gonna be a bumpy, turbulent ride, so stay tuned. Hi, this is Addy, and I'm here to tell you my story with my gastric bypass surgery. I briefly wanted to give you why I had the gastric bypass, because I wasn't totally obese to have it, and although I was overweight, I was probably 60, 70 pounds overweight, and but I had two medical reasons that the reason why I had it done. First off was I had severe gastric reflux that the doctors were concerned about cancer because it was so bad. It was called silent reflux. So I didn't know I had it. It was coming up at night when I slept. I didn't have any symptoms or anything from it. So they were just really worried about that. And the only cure was a gastric bypass surgery. Secondly, I had another illness called gastroparesis, and that's basically the paresis part is where your stomach is paralyzed and it doesn't churn the food in your stomach and get it into your intestines like normal stomachs do. It just stays there and quivers, and then I ended up throwing up every meal after about an hour or so. So anyway, the only cure for that one was the gastric bypass as well. So that's why I had my gastric bypass. So losing weight, the doctor told me, would be just a bonus, basically. And so I went ahead and had the gastric bypass, and I was excited, that I would be losing a little bit of weight with it, honestly. I would be lying if I said I didn't. But so I'm going to start out by telling you what happened, like right off the bat. I did not follow my doctor's orders right away when I had the surgery. And I don't know if it's because I thought, well, this doesn't really pertain to me because I'm not totally obese and that's not why I had it. I had it for two medical reasons and whatever. But I did not drink, the every few, 15 minutes like you're supposed to, and I didn't eat right at first, and so I started on a downward spiral right away, and I became severely dehydrated, and it just wasn't a pretty picture, and it didn't take too long before I started this really bad cycle of having to, go to the doctor, and they would put me in the hospital because I was so dehydrated and I'd get so malnourished. And this happened, this went on probably a good year and a half for me. And I had multiple hospitalizations. They would put me on TPN, which is a food that they would feed me through my IV, and I'd stay in the hospital about a week, and they would do that, and they'd had to put a special IV line in. They'd put it in here, and that's where they'd place it, and then the tip of it runs up to right up here near your heart, because the solution is so irritating to your veins, they can't put it into your vein down here. So anyway, they would do that for about a week, send me home. I would do okay for a little bit, and then after a while I started having these awful food aversions. Actually, every food you could think of, I had an aversion to. I could not eat a bite of food. I could not drink a drink of water. I told the doctor I'd rather be punched in the face than to drink a drink or a drop of water or a piece of food. I could not handle it. So they put me back in the hospital again. This time I went home with the PICC line, IV line, special IV line. They got me a nurse for home care, and I kept the TPN nutrition, and I had to do it every night at home. And that lasted about 8 months. I had a nurse come out every week, change my dressing, and we did this nightly so I could keep my weight up. By the way, my weight by that time, I had dropped all my weight, and I was a little underweight at that time. I flew through my goal because of all of this. But like I said, this was probably a year and a half into it. So then my PICC line had come out a couple of times. First time it was pulled out, they put it back in at the hospital. Then the second time it came out, we just kept it out, and we're seeing if I was doing better, because I had started eating some food then and doing better and all, but I still was losing weight because I wasn't eating enough. So I got down to I'm 5'4", and I got down to about 104 pounds. That was my lowest weight. And at that time, my mother-in-law, who was visiting and taking care of me at the time, she got me in to see her surgeon, and he immediately put me on the schedule for the next day to put a a G-tube and a feeding tube into my stomach. So I had a feeding tube that was stuck out of my stomach, and I'd have to do tube feedings a few times a day to get nutrition into my body. And I still, was supposed to keep eating, of course, because we were trying to get rid of these food aversions I had. And I was on the tube feedings for about 6 months, until one day it popped out on its own. And after that, I was doing well enough, and I was at a healthy weight at that time that I did well enough, and I came off of it, and from that time I did well. And right now I'm at a healthy weight, and I'm very, very healthy. I don't need any assistance with my eating. I eat very healthy. I eat, 5 times a day pretty much, 5 small meals a day. I'm doing like I'm supposed to. I'm drinking all my water. I'm doing very well. I'm doing just like I'm supposed to be doing. And I might not be getting as much protein as I need, but I really try to. The one thing I do as well, which is, protocol pretty much for all these doctors, is I do try to stay away from pasta, rice, bread, and fried foods. The rice, bread, and pasta swells in your stomach or expands after you eat it, and it makes you feel miserable. It's painful. You do not want to go through that. So I'd say stay away from that stuff. And the fried foods just makes you feel miserable as well. It's not worth, having that onion ring or anything at all. So stay away from that as well. And another complication that I want to share with you is that do not take the NSAIDs like they say that cause ulcers, because it is true. I have some back issues, and I didn't take them all the time, but every now and then I would pop an NSAID just to relieve my back pain. And I developed an ulcer. So I don't know if it was that, just sparingly taking one or if I just got it out of the blue. I'm not sure. But I had to have that ulcer removed. The ulcer pain was so severe for me that I ended up in the ER a couple times and had to get pain medication for it in the ER. It was so I was doubling over in pain from it. It was so severe. And so I went to my original gastric bypass doctor and saw him, and he's a very, very sharp guy, and he ended up slicing the ulcer out of my stomach and, repairing my stomach, and the ulcer is now gone. And I had that back in February of this year, and since then I've had no issues. So he did a great job with it, and I do not take NSAIDs now at all, and I'll be on Protonics the rest of my life, something that protects your stomach from acid. So do not take the NSAIDs either. That's another thing I did not follow. So listen to your doctor is what I'm saying, because I didn't listen about the water and the diet in the beginning. I did not listen about the NSAIDs, and they know what they're talking about, so please listen to them. So one more thing, hear me now. If I had to do this all over again, knowing what complications I was going to go through, I just want you to know that I would have the surgery again. I know it sounds crazy, but I would. But it did cure both of my issues that I was having, the reflux and the gastroparesis I no longer have. So that's a win-win situation. And it also brought me to my goal weight. Right now, today, I stay between 120 to 125 pounds, and I'm 5'4", so that's a good weight for me. I just feel better. I'm healthy. I'm able to go to the gym and work out. I feel really good. I just feel this whole experience. I know it was crazy while I was going through it, but now that everything is past behind me, I just really feel like I'm living a really good, healthy life. And that's my story in a nutshell, and I hope that I just want to tell you one more thing. This is a very rare situation. I want to say that, and I think we said that in the other video that Joe and I did together, that the rare situations find me. This is not normal. It's very rare for this type of thing to happen. So don't let me scare you, because the 1% of what's going to happen, people, find me. So please don't think that this is a normal occurrence. It's not. And I did, like I said, I did not follow my doctor's orders in the beginning by drinking every 15 minutes and by eating what I was supposed to. So I think, I got off to a bad start, and I just couldn't recover after I went down that slippery slope. So that's what it is. That's what my story is about, and I hope it helps, So follow your doctor's orders when you get the surgery, and don't get dehydrated and malnourished like I did. And hope this helps. And I'll see you later. I'm out. This is Addy. Bye.